The Boston Public Health Commission recently expanded its violence prevention efforts by adding trauma response teams to 3 more neighborhoods. To explain how the teams work are 2 guests from the commission, the Violence Prevention Program Manager, Tegan Evans, and the lead crisis clinician, Charlene Luma. Thank you both very much for being with us.
Thank you.
First, I want to start with Tegan. Talk about what's going on and what are these teams made up of exactly?
Yeah, so these teams were really developed as part of about 14 listening sessions that we had over the summer, last summer from May through August, where we really engaged about 350 families, providers, residents about what they really needed immediately following an incident of violence in their community. And what we learned is that we really needed to provide support immediately, both behavioral health and basic needs support to families who've been impacted by violence, as well as the larger community. So really being able to support the larger community, provide information and access to ongoing resources that are available to them, and then to be able to support them long term with recovery and care services at local community health centers. So we really use that information to develop a request for proposals and have funded now 5 teams in Roxbury, Dorchester, Mattapan, East Boston, and Jamaica Plain who really work together along with our mobile vendor, which Charlene can talk a little bit more about, to really respond to individuals who've been impacted by violence and provide those those necessary services so that they can heal from these incidents of violence.
Charlene Luma, you're the crisis clinician. So what does that mean when you get the call?
So that means when we get a call on our hotline, usually people are calling about a specific incident around community violence. So we do an assessment to determine what the specific need is. Sometimes it means going out into the community and supporting individuals who may be on scene, or the following day doing a home visit, but also reaching out to other providers in the community who can support individuals and families. So community members will respond and will do outreach. We'll make sure that people have the information related to trauma, but also doing some case management and connecting individuals to resources in the community like the health centers.
What kind of things happen to people? Let's say you're a survivor of violence. A lot of us who are not touched directly, we might say, oh, well, if you don't get shot, you don't get stabbed, you should be happy. But you know, I mean, psychologically, you know, how are these people going to function?
Right, so the impacts of trauma vary by individuals. So some people have some physical reactions. People may have a difficulty with sleep, eating, loss of appetite. Some people may have emotional reactions, really feelings of anxiety or depression, sadness, not really being able to get out of bed and being isolated from other people. And others kind of are resilient enough to get through the event and are supported by members of their family.
So I can talk about sometimes the wide community you need to contact when there's an act of violence. I'm thinking of cases that there might be a classmate at a school who's victimized, and you get dozens, maybe hundreds of kids affected by that.
Sure. So it's really important, like Charlene was saying, that we reach out to our partners like Boston Public Schools and other community-based organizations who are kind of really working with these kids on a day-to-day basis to be able to provide both those teachers and service providers with support, and also to be able to come in and offer some individualized support for the young people. And when these types of incidents happen, they really do touch a really wide network of individuals. So that's really why it's important that we're kind of going out into the community after an incident is happening and really letting people know that we're here, that there's services available to you, that this is the way you're feeling is normal. And there's people here that want to help you.
This is BNN News. We're talking with Tegan Evans and Charlene Luma from the Boston Public Health Commission. Charlene, talk about just what that's like after an act of violence, and you're affected by it, you're surviving it, and you have someone who wants to listen to you and who thinks this is really important.
So, I mean, after an act of violence, you have to remember people are dealing with one of the most difficult things in their lives. and they're really trying to stabilize. So we talk about what it looks like, what are the next steps that need to be taken in order to support the family. Oftentimes after a homicide, it's really figuring out what the funeral is going to look like, and making sure that the children are supported. So getting connected to their schools, helping families think about what the next 24 hours are going to look like, what the next 48 hours are going to look like, and what the next week is going to look like, so that there's a plan in place. So we really help families think through that process, and then identify longer term needs. So that's when the recovery services come into place. So making sure people are connected to their primary care providers, and making sure people are connected to therapy services if that's what's needed.
Megan, it sounds like this is not a one-size-fits-all thing, and that's why you have different teams, because you have different neighborhoods, different populations,
Yep.
different cultures.
Yep.
And what about the long-term needs? Because you've got partnerships with community health centers, because I take it that some of the help that people need, it's not something that's all taken care of within a week or two.
Absolutely. And sometimes, and a lot of times, people aren't ready to really
Yeah.
engage in those services right away.
Okay.
So it's important that, one of the aspects of these teams, and something that was really important to us, is that we're kind of thinking about how we engage with individuals who've been impacted long term. So continuing to kind of connect with them and to see what they need, and if they're ready for some additional support, if that's something that's really would be useful to them. And then, our clinical teams really work as a dyad of a clinician and a family partner. And so they really work closely with families to be able to think about kind of what are their long-term goals and how can we support you in getting there. So it may be that they need some of the behavioral health support, but it may be that they need to work with a family partner around to be able to support them with basic needs, with different challenges that might be preventing them from getting work or housing, or maybe there's food insecurity in the home. So really thinking about this much more broadly than just the behavioral health piece. And families, I think to your point that there's really so much more that families needs beyond just the behavioral health piece, and it looks different for everyone.
Charlene, families in a crisis, they're often worried about confidentiality too, whether because of immigration or law enforcement concerns. Talk about
Right, so the services are voluntary and free, so anyone can access the services. We work with residents of all ages. We work with families and children. And one thing that's good about the service is that if you call the hotline and you kind of speak to a clinician and you've identified a service that the immediate team can address, we'll make sure that you get connected to appropriate resources.
And finally, that hotline number?
It's 617-431-0125, and it's 24 hours a day, 365 days a year. Someone will always respond.
Thank you both very much.
Thank you.
Charlene Luma and Tegan Evans from the Boston Public Health Commission. Up ahead, boosting ridership and service on the Fairmount Indigo line.